Good morning, Dr. Oshani Ironika. This is Anjana here to talk about the system for independent study. In this presentation, I'm going to talking about the domain, problems, approach, feasibility study, and timelines also. Our client is the Pediatric Intensive Care Unit, which is located in Chichi Hospital, Anuradhapura, Sri Lanka. With their permission, we had been there to observe day to day activities. We have gone through their document which they are using these days. We have received more samples for example, admission, treatment, and the referral for the microbiology test, hematology test, and the transfer form also. But they had more. We received all those forms. We had a few minutes to talk about with them also. So when we talk about, we had go through more and collect the more data also. So this is our systems, the Pediatric Intensive Care Unit Management System, PICU Management System. It's web-based Pediatric Intensive Care Unit Management System for Anuradhapura Teaching Hospital version 1.1. So when come to the problems, we have picked more problem, but some of you we defined here which are most to solve, especially lost document. They are using the document with the inadequate data. They have a proper form, but in case of emergency, they couldn't use it. They come of view with a blank paper or other papers. They can't access the proper relevant data on time. Less privacy control. While they receiving the report or transferred to their treatment history, they couldn't keep it that privacy because they transfer with all files by their minor staffs. So during that, it may be happen. They don't have a proper scheduling and the maintenance which they want all document because time is limited. At the same time, human resources and other resources are limited. So they have been facing those problems because of that. When they admitted that patient, they usually give a bed head number. It's unique for each patient. It's also sometimes duplicated because when nursing officer going to be swept duty during the few minutes or particular time, sometimes maybe it happened. Then limited access and usability. They have all data, but we can't access if we want anytime or anywhere. So we never use those documents where we want. There are no way to obtain the historical data. That means we can find about the summarize of the history like a weekly, monthly, yearly. As example for the how many dengue patients were admitted in the PCIU during the 1 week. They have all data. They have keep it in the proper file, but we couldn't uh, receive all file because of the time and they need a time to collect all data and make it all those. So these are the main problems for that. Then when come to these solution for these problems, they needed well defined automated computerized systems. So it might be well web based or else online based. So, for the aforementioned reason, we have a plan. We are going to develop the prospective system for PICU. When come to the web-based, they can be browsed anywhere, anytime, with any devices. That authorized page who's going to be access these systems, they can access relevant system especially for the each of interfaces to facilitate to uh, update or else input, retrieve data, update their records, uh, and they can monitor according to their management level. So this system going to be helpful for them when come to the old reports collected or maintaining properly will be in a future. Feasibility study we have done go through, we received the feasibility study report also. So finally we come to the report, we know that operational wise it's well, all staff can do that, they are well educated, they have enough knowledge to technical wise also, so there are no issue to go through that. At the same time technology wise also is live it's well, they have uninterrupted electric service and the wi-fi connection also, especially networking, they well defined. At the same time, all staffs may usually have Android mobile tabs, computers, so wherever they can use it because of it's a web based. If they can use it if they are be in out of their workstation or inside, wherever, anytime, in case of emergency also they can see it all. Then other point is we analyze to the barriers to the legal implement of the system. It's also come to that point. It's also done come to that point with their certification of the system, license, copyright, with their management. They also will cooperate to do that. So now we will clear about the legal and ethical requirements as well. Timelines. We know that time is limited, they need a system as soon as possible. So when come to analyze the proposed system according to their requirements, we have developed the timelines which is see on the screen. Thank you so much. Especially thank you, Dr. Oshane Runika, because you have well guided to us to develop or doing this system and giving the proper data and the proper guideline also. And thank you so much to director, deputy director, and the consultant pediatrician nursing officers who are working in the PICU and Shradapura. Thank you so much. Then we'll meet again the next presentation.